So welcome, Belén Garijo. You are the new CEO of Merck since this very month. So this should be, or is, I think, one of your, so the first public appearance as a CEO, formal appearance in front of a public crowd. So thank you very much for joining us. And I do a short intro. So you grew up in the southeast of Spain, and I'm not even aware if that's half true, but I found an interview with you where you said that an American TV series, a hospital series, inspired you to become a doctor in the first place. Is that true?
Yes, thank you very much, Jochen. And you are right. This is my first public appearance as the CEO of Merck. I'm very pleased to be here with you. I feel that I always wanted to be a physician. I speculate that this could have been the case, right? Because that film impressed me very much. I have some doctors in the family, but not many.
Okay. Mm-hmm.
And therefore, I speculate that this could have been the reason why this interest for science and medicine grew so fast on my side.
Okay. So now you have a PhD in clinical pharmacology. Later, you got an MBA, started out in medical research, and became very super successful as an international manager. And you moved, I think, to Darmstadt something like 10 years ago already. You became head of the pharmaceuticals division and restructured it quite successfully at Merck. And now you are, and there are a lot of profiles about you these days, and in every single of them you find, so they are mentioning that you are the first woman who runs a company on her own as a CEO in the Deutsche Aktienindex, and all Germans are really impressed. And on the shelf in your office, I think I read that in, Manager Magazine, there's a sign, "Women belong in all places where decisions are being made," which is a quote from Ruth Bader Ginsburg, the late Ruth Bader Ginsburg. Is it true? Is there this sign in your office?
It is true, yeah. Someone gave that to me, and of course I kept it because I really like it.
Cool. So just as a friendly reminder, Merck is the German science and tech company with more than 70.5 billion euros of revenues last year, and maybe a little more this year. Nearly 60K employees, and started as a pharmacy in Darmstadt more than 350 years ago, and is focusing on pharmaceuticals and also advanced lab chemicals, and in the third division in electronics like liquid crystals and OLEDs, and sports and world market share in this area of, I think, 60% or something like that. So zooming back, you're quite successful during the pandemic as a company. And I was wondering, do you still remember your first day when the pandemic hit Merck? Can you remember what you were thinking and what you were doing at that day?
I do remember like if it was yesterday. Those were busy times. We were still traveling, and I remember very well that when we saw the China news and the developments in China, we started to prepare. So the first day of the pandemic to me is taking me back to mid-February 2020, when we called the crisis mode in the company. We prepared the company for the worst, right? And together with our chairman and CEO at the time, Stefan Osman, we organized at the executive board level to manage the crisis forward. I believe that anticipation that we had was absolutely key to prepare our company to deliver on the two objectives that we had, guiding our efforts. I can come back to that later if you want. But on day one, the discussion was, let's get ourselves organized, let's put the right people around the table, let's provide leadership and champion these efforts from the top, because this is going to be really getting big for the world. And many people were skeptical around us. questioning what we were doing, right? Why have you banned traveling as of February 29th, 2020? Aren't you exaggerating? And I was absolutely convinced that that was the right thing to do. And it showed that it was the right thing to do. So I do remember that day.
Yeah. So maybe it's a strange question, but so a lot of experts predicted for years that this will happen one day. Nobody knew when, but we knew that at some point in time, there will be this global pandemic. Why weren't we prepared? And especially experts like you were in a way, you dealt very well with the crisis. But on the other hand, I was wondering why the whole sphere of pharmaceutical business wasn't prepared for this.
Well, I think that the pharma industry has been always very well ahead of the curve, right? Because we look at long-term innovation. So, you know, I could use the example of the vaccines already. The fact that we were prepared, the fact that many companies were prepared, using the research of many, many years to actually pivot and refocus on the vaccine speaks of preparation. In a way, long-term orientation has taken us to where we are today. As a science and technology company, we were very well prepared. Merck has been very, very, very well in the leading front of pandemic preparedness. And once again, referring to the past, in 2019, we gave an award, a very prestigious award of this company went to investigators that were already researching options in the context of pandemic preparedness.
Wow, okay. So obviously we were prepared, but you mentioned the word pivoting. So they had many things had to change also at Merck, despite the fact that you were better prepared than car manufacturers or whatever. How agile can you be in a 17 billion euro business? How does agility work on that level with nearly 60K employees? How do you do that?
I love this question. And you know, the pandemic has shown to everybody that speed is of essence, right? Speed and agility will be absolutely key, has been absolutely key and will be absolutely key for the future. So look, we over the years, as part of our transformation, have simplified our structures, decision-making, focus much more on accountability from all our leaders. And this is helping, you know, it's a never-ending journey. Yeah. Are we where I would like to be? The answer is no. And with the new executive board, we are going to focus quite a lot on continuously shaping our culture to deliver much more agility, and really at the same time, focus our people on understanding that after the pandemic, during the pandemic and after the pandemic, agility has been of essence. And now, post-pandemic, hopefully at some point in time, post-pandemic, all the global standards for innovation have really raised. And the demand on our industry, on our company, a company that is addressing major macro trends, the level of exigence and demand is going to raise exponentially. So, you know, in that context, I always say that I consider myself part of the first promotion and COVID and post-COVID CEOs. And with our company being in a position of very solid strength, I also feel the pressure, right, on taking the company and securing our future through mobilizing our organization, and so that our teams understand that there is no time for bureaucracy in our company, that we need to deliver, and that 1 minute makes a big difference for patients, for our customers, and for the communities that we serve. And this is going to be very centric to our communication and, more importantly, to our actions and the way we lead the company forward.
I'm not sure if the thousands of people listening in are aware how you work together with the leading companies during this pandemic, like BioNTech. Can you give us just a short overview where you're active in this field these days? It's a broad range of products you offer, right? From lipids to whatever. Can you just give us a general overview for a general audience?
Absolutely, absolutely. So our company is a globally diversified science and technology company, as you mentioned before, in which almost 60,000 curious minds dedicate ourselves to advance human progress. And how do we do that? We do that through having leading presence in three major sectors. The first one that has been very centric to the pandemic is our life science sector. Through our life science sector, we have supported up to 50 vaccine manufacturers and projects from the very beginning of the pandemic.
People listen to that. It's 50, right?
50, yes. We have also supported testing. By the way, we have our own testing in the company that we established back in that first day that you were asking to me about before. We have our own internal testing capabilities for our employees and the community. So life science supporting 50 vaccine manufacturers, 35 companies providing testing, and also many others investigating, researching therapeutics, mainly neutralizing antibodies. Then our healthcare sector, I was at the time I was still in the healthcare sector, and we really turned every stone to identify opportunities in our pipeline to focus these options to address and to contribute to the fight against COVID-19. And then, of course, our electronic sectors, very well equipped after the Versum acquisition with a super promising, highly attractive semiconductor portfolio, became absolutely frontal to advancing digital living, what has kept us connected during the pandemic, and that will actually mark the rest of our lives and the rest of the century on the way we communicate and interact remotely.
You're a core supplier to BioNTech. Germany is really proud of BioNTech, so I have to ask this. Since you're producing, advanced lipids, which are the carrier of these mRNA systems they're using, could you imagine, so I realized that you're invested in that field in different areas already. Could you imagine to move further into the mRNA vaccines business?
Well, we have been supporting other companies as well. By the way, I am a proud resident of Germany, and I feel also very proud of the BioNTech, critical contributions to this fight. We have supplied lipids. We are scaling up the lipids. We are also providing other raw materials to manufacture vaccines, like single-use bioreactors, which are extremely critical to keep the pace and to continue to scale up biologics manufacturing, including vaccines. And we are a leading provider of filtration systems. Are we going to advance on the mRNA front? The answer is yes. We made an acquisition of a small company called Amtech with the intention to put a foot in the door, if I may say so, in the mRNA space. And our vision is that this technology is going to be revolutionizing immunotherapy, right? Also in other fields like cancer and autoimmune diseases, which is very centric to our healthcare strategy. So gene therapy, mRNA as a nucleic acid option is something in which we have contributed already, but in which we are looking forward to the future with increasing involvement in the mRNA space.
How fast will we be able to provide the whole planet with vaccines?
Look, if you read everything that main vaccine manufacturers in mRNA, but also other differently designed vaccines, it seems that the commitment of the industry is to continue to provide billion and billion of doses to serve the whole world. And how fast is this going to be? Of course, faster and faster. If you look at the most recent months, we, as a critical supplier of raw materials and other critical materials to manufacture vaccines, have made already major investments to be able to keep up with the increasing demand. So I am optimistic that 2021 is going to be already giving access to many countries to the existing vaccines, to all the vaccines that have been approved. Other vaccines will join in coming weeks and months. And the most important element is that the trend is accelerating. And the trend is constantly accelerating. And we need to make sure as a company, as a responsible company, that we give access to the world through the ongoing public-private partnerships like COVAX, in which Merck has participated from day one. So I'm very confident, highly confident, that we are in the right path, and that now with the joint efforts of policymakers, regulatory agencies, and the industry in several sectors, we are going to get this done. Then the next question is this going to stay for the future? You know, is this going to stay endogamic? And we are, I think it's likely that this may happen. And we are preparing ourselves for that because, you know, this cannot happen again. The level of preparation has to go and stay for the future.
Or the pandemic never ends because we have all these mutations circling the planet for the rest of this decade, maybe.
Yeah, you know, this can become like flu, but having vaccines and therapeutics to address the disease will ensure that we don't have to deal with a global health crisis like the one we have seen in recent months.
The US has thrown its support behind the move of the World Trade Organization. I'm sure you are aware of to temporarily lift patent protection for vaccines in the corona space. Could you comment on that?
Look, there is no simple solution to making sure that each and every citizen of the world will have timely access to the vaccines. Patent and intellectual property protection is absolutely key to continue to innovate, not only in the vaccine space, but also in other unmet medical needs. If I would be convinced that this option would contribute to solving the existing issues, I would start thinking about, okay, could this work? But this is not going to fix the issue. and actually it could make it work. It could make it worse. It could make it worse because the bottlenecks that we have seen during the pandemic obviously speak of the criticality of certain materials, right? The complexity of the technology that is associated to manufacturing vaccines, the super high qualifications that we need and the new capabilities that we have built over months to be able to deal with everything. If I take only the single-use assemblies, the single-use bioreactors that I mentioned before, which is so key, right? And in which we are investing very heavily to ramp up faster and faster and faster, I couldn't imagine a world in which those critical materials wouldn't or would have to be provided to many other companies. This will create bottlenecks. So, you know, our position is that protection of innovation is absolutely key, and with a very strong commitment that I have seen across our industry to supply to the needs of the world, I think we have to think twice about breaking certain paradigms that may get the situation more challenging overall.
You announced, so let's step back from the pandemic for a minute. You announced that you're planning smaller and maybe larger acquisitions next year. And you have a as a company, you have a track record of buying interesting small and large companies. So which technologies are you looking into these days?
Look, we will be able to. We are right now in the middle of our strategy process, running our technology strategy, and we will be communicating this publicly probably around early fall. But if you ask me today, I can say we are entering the 2020s in a solid position of strength, right? We have defined our 3 major pillars to deliver profitable growth for the future. Those are process solution in life science, the healthcare pipeline, and our electronics business with this leading portfolio on semiconductors. So we are going to, anything that we do to enhance the potential and the value creation towards the future will go around those 3 businesses. I already mentioned our increasing interest in novel modalities, including mRNA. We have to use the strong position that we have in life science, mainly our process solution business, but also research, our contributions to research, to be able to cover and broaden the scope to including novel modalities. Cell and gene therapy, in which we already have significant investments in life science in particular, right? I think on the healthcare pipeline, the challenge is going to be to continue to increase our participation in specialty medicines, keeping our base business stable, addressing some of the potential opportunities that we see in emerging markets. Remember, China is a very important market for us, and the way our portfolio play in China is slightly different than in other countries. So we need to catch up and ensure that we participate of the booming innovative business of China as well. And these principles will be guiding our thinking in order to be able to make the right capital allocation decisions to expand our 3 pillars to the future.
What's your view on the semiconductor space, which is really interesting to see these days because there's this crazy chip shortage, which is connected in a way to the pandemic. But a long-term view is also very interesting. A lot of new startups move into that space. So the new hot thing is hardware, not software. And you're super active with liquid crystals and OLEDs and things like that. What's your view on the semiconductor sphere?
A super highly attractive market. This is the reason why we made an acquisition, the acquisition of Versum, which is now a very important strategic driver of Merck.
So one of the largest in your history, right? 5.8 billion.
Yeah, well, we have made bigger acquisitions.
Yeah, one of the largest, I said.
Yes, okay. Yeah, one of the largest. Yeah, but you know, that was absolutely critical to our strategy to turn around and refocus our electronics business, then called performance materials, to becoming a vibrant electronics business that is addressing the most important macro trend of the world, digitalization, right? So how do I see that? I thought, I always believed that this acquisition was very strategic and actually the right thing to do. Is providing growth, is accelerating the growth of electronics and partially compensating the declining liquid crystals business, which is now getting to a plateau. And I see significant synergies between our display business and our semiconductor business. So definitely highly attractive, highly interesting for us. Of course, the shortages of our customers on the end market, right, presents an opportunity for our company as soon as the major chip manufacturers deliver additional capacity, because right now the bottleneck is coming from our customers' capacity to supply the markets to demand. So we are going to be very active on this, eventually contemplating how do we expand and take that business to stay highly competitive, but also to take it to the next level of technology, so that we take benefit of this highly customer-centric business and such an attractive environment.
What is the most important skill for a leader in these pandemic times? To come back to the pandemic for a minute.
I would say is empathy, right? I would say if I have to choose one, is being staying present, being connected. What we have always called in the company being present in the distance, right? Engaging with our teams and employees around the world to understand how do we better support the teams. So I think empathy. Listening, of course, is part of that, but really understanding and exercising this proximity to the employees and to our teams, and really removing obstacles and enabling the teams to perform is what I found most important during the pandemic, but also beyond the pandemic.
This is interesting what you say, because I did an interview in another series of the ZEIT with the CEO of Slack. I'm not sure if you're aware of this software. It's a communication platform for companies. And he said exactly the same. So the one quality you should have, and he's a software guy, right? It's empathy. It's interesting that you say the same. Did you ever, so you said about yourself that you're capable of making it in such a drifting environment. This will always happen. You will fail in some situations and make the wrong decisions. So what do you do if you make a wrong decision?
Look, first of all, when you make big decisions, you have to understand what are the risks, right? And you have to understand what happened if you fail. And you have to understand that a priori. What are the consequences of failure? This is super important to make bold decisions, right? And we make many of those. So anticipating the potential consequences of your failure is where everything starts. Mm-hmm. And if at the end you get it wrong, this allows you to be prepared to manage and mitigate the potential consequences. Mm. I think this is, and then of course, I am very fond of what I call the forensics, right? So what do you learn from that, right? What did you learn from?
Sorry, it's a funny word for that, but I like it.
I call it forensics or postmortem analysis, right?
So the pathology of the dying business.
What can you learn from that? You know, a learning organization is always looking at, okay, what can we do better next time, right? And that's basically what the debate is about.
Angela Merkel, I'm not sure if you're aware of that, but you're living in Germany. So she recently apologized to citizens for a wrong decision, which was quite interesting. Do you think that was right? Should you apologize as a leader from time to time?
Of course. I mean, I took this as a sign of strength.
For strength, right? Mm-hmm.
I took that gesture of the chancellor as a sign of strength, right? When you get it wrong, you have to explain why. And eventually, if there are consequences for the public or for your teams, you have to be humble enough to apologize. So I think this is a strength of leadership. And you know, this is the way I took it in that case.
We have to come to an end soon, but let me ask you about we mentioned your career in the beginning, and you're one of the top women in business today. But at the start of your career, it was really complicated to get even to enroll into medical school, as far as I am aware of. And you camped on the campus of the university, I think in Madrid, to get your space, your place at university. Do you remember these times? Can you tell us a little bit about how you enrolled in medicine and why it was so complicated?
Well, the process there was the first year of the numerus clausus back in Spain, and the conditions under which you would be admitted or not weren't public at the time. So of course I have a plan B, right? There is no good plan without a plan B. This is the
you always say that. So you had that at that time already. Yeah, okay.
So I had a plan B, but I was absolutely determined to go after my dream, because it was a dream for me, that I put it at that level. So when you have a dream, fighting for it is what really drove me to do that. So we joined forces with other people in the same circumstances. And actually, we went to the right places, spoke to the right people, and at the end, we got it done. And I was happily admitted to medical school, and we took it from there.
My whole newsroom, my woke newsroom, will kill me for that questions. But are there differences in leadership style of men and women? Do you think so?
Look, you asked me about expectations for leaders, and you actually gave me a very important testimonial, right, from a conversation with another person. I think expectations for leaders are becoming more consistent and are the same. Then, so expectations for leaders, the same. A leader is a leader. I think style may be different, you know. I think we tend to be a bit more straight. We tend to be focusing on the outside rather than focusing only on yourself. I think this is a very important element of this. So on the style, there may be differences, but those are not gender related, right? Those may be person related. culture related. So this is what I see, right? I haven't been able, over the years, I received this question many times, and now this is the way I put it for myself, right? And for the company, of course, we have similar expectations for leaders across the company that we communicate and voice to them very clearly. And then we try to keep the diversity of style, which is so important, right? And the diversity of thought. Being genuine, being authentic is something that we care about. And it's not only in my case, but for the leaders of the organization, in order to be able to generate trust. People can trust you because they know you don't have a hidden agenda, right? Because you communicate with clarity. So I think keeping the style of each and every leader, to me, is absolutely essential.
There's a wonderful TED talk of your daughter talking about being the motherless child, as her teachers said, because you almost never showed up at school. And she later mentions that you are a role model, as not only as a mother, but also as an entrepreneur, and inspired her. Do you think there are too few, and you are the outlier in the Deutsche Aktienindex now, too few role models of women doing jobs like yours these days?
So do I consider myself a role model? Is this the question?
No, I assume that you are already, but I thought, why do we have a shortage of women going to top management positions? And I was thinking, you need examples like, well, Angela Merkel, and then all the girls think, okay, I can be a politician too. I can be chancellor one day, and we can do that again. But in your space, there are just a few women these days. Maybe that's a feedback loop that you have to end by promoting more women into that space.
I think each and every company, starting by our own company, is putting tremendous emphasis on gender equality as part of our diversity programs, and we have made progress, right? We are already at 35%. Overall in the company, but with some function and sectors performing a bit better. So you have to, in the private sector, there is a lot that we can do, right? And understand, and truly understanding what are the barriers have taken us a bit of time, right? To conclude that at the end, the societal barriers are equally important. And many times these are in our mind, right? I recently said, I am frustrated when I talk to our young female talent, and I hear exactly the same concerns that I had in my mind 35 years ago, right? So we have to progress at all levels. The commitment of the private sector is very clear. Societies have to allow decrease the pressure on the female, right? Breaking stereotypes, making sure that, we educate our populations to see this as the new normal. This is the new normal. This is the real new normal, diversity and equity, right? And my aspiration is that we continue to put a lot of emphasis on this, not only for gender, but also for other elements of diversity, which I consider to be as important as diversity of thinking, as diversity of leadership styles, as ethnicity, you name it. So,
unfortunately, we have to come to an end. And so I'm not sure if I'm well informed, but I read that for your last birthday, you got a German cookbook. You mentioned that in an interview. Did you find, and you hoped 1 year ago, so last year, that you will find the time during the pandemic to cook a German dish because it's one of your hobbies. Did you managed to cook a German dish already?
Of course, I cook everything.
No,
everything.
Come on.
I cook
so
everything.
What's your favorite German dish?
Come on, don't put me on that spot because I have to make a choice. But actually, you know, on the German side, I love the Apfelstrudel. I don't know if I said it correctly. Yeah, and this I cook as a dessert frequently.
So this is the first German word I heard from you, and you're here for 10 years now, I think, but never, because of a shortage of time, never managed to, have this proper German course. But can you order a wine or something in German? Sprechen Sie ein bisschen Deutsch?
I can speak some German, but this is shame on me. I don't feel proud of not being fluent in German, if you ask me.
Okay. So thank you very much for joining us.
I say a few words. I say
please.
A few words. Huh?
Okay, can you say something?
No, I will not here. Not here.
Okay. Belén Garijo, thank you very much for joining us for this first public conversation as a CEO. And good luck in these strange times with Merck and with your job. Thank you very much.
Thank you, Jochen. And if today was Friday, I would say schönes Wochenende. But
Perfect.
Since it's Monday,
that's the most important thing you can say in German.
Bye-bye.
Thank you. Bye.
Bye.